When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
When evaluating potential hires for your small business, it's essential you look beyond resumes. Sure, a candidate may appear impressive on paper, but understanding the person is crucial. LinkedIn, the world's largest professional network, provides a complete view of your candidate's skills, experiences, and interests. With LinkedIn's up-to-date data, you can be confident that you really know who you're hiring. Post your free job at linkedin.com/achieve. That's linkedin.com/achieve. Terms and conditions apply.
Welcome to the Dr. Raj Podcast. Today's episode features Everyday Rheum, a guest series hosted by Dr. Michelle Koolaee. She is a board-certified rheumatologist with a direct care practice in Pasadena, California. She trained at the University of Pennsylvania and serves as faculty and educator at Huntington Hospital, an affiliate of Cedars-Sinai. Inspired by the conversations she has with her clients every day, this series brings practical insights in rheumatology to patients and the medical community alike. And now, here's today's episode.
Hi, and welcome to Everyday Rheum. This is a guest series on the Dr. Raj podcast, and this podcast is inspired by the real conversations that I have with clients every day. Our goal is to bring you knowledge, support, and encouragement to help you manage your rheumatology needs with confidence. So today's episode was inspired by conversations I have almost every day as a rheumatologist about one of the most disruptive and elusive symptoms, which is fatigue. Now, many clients are referred to me to evaluate for autoimmune disease as an underlying cause, which is not uncommon. And as a rheumatologist, I do investigate lifestyle factors, but for some people, the fatigue persists despite these assessments, leaving them to feel frustrated or defeated. And so in this episode, I wanted to bring awareness to functional medicine as an alternative approach, highlighting another path for those that are seeking answers and treatment when the traditional routes haven't fully resolved their symptoms. So I'm incredibly grateful to have met Dr. Elise Pomerance, who's here to enlighten us about how functional medicine, that approach can assist in evaluating chronic fatigue and improve health. Dr. Pomerance is a highly experienced, board-certified family medicine physician with a strong foundation in public health and a very impressive professional background. She attended UCLA School of Medicine, has a Master of Public Health from the Harvard T.H. School of Public Health, and completed functional medicine training through the Kalish Institute. She discovered functional medicine after navigating her own health challenges and is now co-founder of Eleena Health, a functional medicine practice dedicated to personalized integrative care. Dr. Pomerance, hi. Thank you so much for being here today.
Thank you so much for having me.
So tell us a little bit about yourself and how did you make the jump from conventional family medicine to functional medicine?
Yeah, well, I came by it honestly. So, I spent 20 plus years of my career in the conventional sort of approach to medicine. And then I had my own health event happen. I was diagnosed with an adrenal adenoma. So this was a benign, not cancerous tumor, and it was attached to one of my adrenal glands. And that sits on top of your kidneys, and it had to come out. And so while they were in surgery and taking it out, the surgeon accidentally nicked my gallbladder and had to take it out because you cannot repair a gallbladder once it had an injury like that. And so, taking the gallbladder out, which is called cholecystectomy, that's the most common elective surgery. So I think most doctors believe that you really don't need it. And in fact, my surgeon said to me, quote unquote, "This will have no impact on your life." Famous last words. So about 6 months after that surgery, I was having daily diarrhea. And I went to all my doctor friends, other doctors. I had all the tests. I had all, upper scope, colonoscopy, all the tests. And no one could explain this. Everyone was trying to give me things to just stop the diarrhea. But eventually what happened is that functional medicine found me. And through a lot of studying biochemistry, I came to understand that I was actually not normal going into the surgery. I had had a lifetime of many things that are very noxious to the gut and disrupt the physiology of the gut. So things like hormonal contraception I'd had for decades, ibuprofen, which I took for terrible cramps, and doxycycline for acne. All those things are injure the intestine. So I had been having occasional bouts of diarrhea prior to surgery, but I always explained it away as something I ate. But now after the surgery, I no longer had this very delicate release of bile into my intestine, which is what the gallbladder is going to do for you. And that was the straw that broke the camel's back. And so I basically realized that the integrity of my gut was very compromised, and therefore I was having a leaky gut, and the surgery made it worse. And so now, because I had a leaky gut, there was undigested food and potentially pathogens or microbes that are entering into my bloodstream directly, which is like a 5-alarm fire for your immune system. And this is what was causing the diarrhea. So ultimately, I had to stop dairy, gluten, eggs, which stopped the diarrhea immediately, and then heal my gut. And that was a long, probably 1.5 year adventure for me, trying to figure that out and then heal it. And kind of once I understood that, I felt very empowered and felt like, wow, this is nobody in the conventional world could explain this. And there is this whole world of information out there that can actually help people feel well. And that's when I dove down deep into the rabbit hole of functional medicine.
So it truly is that functional medicine found you.
Yeah.
Yeah. And that through that journey, then you're able to, so then it became a natural transition just based on your own life experience then, right?
It really did. I mean, it I just returned to this passion for seeing patients and helping them figure out these difficult problems. There's always a reason, right? You just have to, if you spend the time and you dig deep enough, you can find the reason. And
I think that just even what you described in your own personal experience, I think that really helps people that are listening to understand, what does a functional medicine doctor do?
Yeah.
Because, we're going to talk about that later, but I think that is such a powerful story. And I think that really helps in understanding, what it is that you do and what is functional medicine. So transitioning to that, how would you define functional medicine?
Yeah. So it's such a wonderful question because people just really, I think there's different understandings. So my understanding of functional medicine that it is a framework for health that really seeks to understand the underlying root cause of illness. And I like to use the iceberg metaphor to explain that. So if you think of an iceberg as a person, the tip of the iceberg are their symptoms. The symptoms that the person is experiencing. They are the outward manifestation of some process going on in the body. And in conventional medicine, we largely spend our time here. So an example would be a patient comes in, they have an itchy rash on their arm. I see it, I diagnose it as eczema, and then I prescribe a treatment. And in this case, maybe a steroid cream. But at no point, generally, is someone asking, well, why are you having eczema? What is happening inside there to cause this? That's, I'm curing the symptom, or addressing, a better word, the symptom with the steroid cream, but I'm not really identifying why it happened. So that's where functional medicine comes in. So we go under the water to the remaining and largest part of the iceberg, which reflects what's going on in the body. And that's where we focus. So we understand, so in functional medicine, what we do is we understand that all of the systems are completely interconnected and that from health to disease is a continuum. And the body systems are failing all along the way from health to disease. So in functional medicine, we are trying to identify which systems are out of balance, not working properly, why, and then restore that balance, which ultimately will impact the symptoms as well.
So I think that the big question is that the big question that you're looking to answer is the why. I think it is really diving in and trying to answer the why. And I think when I have conversations with patients and I explain functional medicine, number one is are all functional medicine doctors medical doctors?
So that is also a great question. The answer is no.
Mm-hmm.
So functional medicine, I think, has been a little bit of the wild, wild west. So it's been around for quite a long time. It's all science-based, but there hasn't really been a formal structure around it. And I think it's starting to hit the mainstream. And so these structures are starting to form. Different people can identify themselves as functional medicine providers. It can be everywhere from a doctor, an MD or a DO. It can also be nurse practitioners, physician assistants. So these are licensed medical people, but it can also be sort of non-medical people like traditional Chinese medicine doctors, acupuncturists, chiropractors. And so I think it's important when you're seeking out functional medicine that you understand what the provider has been trained in and how they've been trained in functional medicine as well.
And thank you for explaining that, because I think for, again, people that are listening, I think your perspective, Elise, is that you are an experienced medical doctor with that traditional evidence-based medicine. You're rooted in that. You're
Yes.
well-versed in that. And so I think you're bringing so much more to the table. And I think it's important because, again, people don't know that. And I think that you just explaining that, I think, is really helpful as people are navigating and figuring out like how to best, what supports to create for themselves. So thank you for that. So I recently referred a lovely young woman to you. She has chronic fatigue, and she saw me after I ruled out autoimmune disease. And some of her symptoms, they did improve with better sleep hygiene, but the fatigue was still bothersome. And so she came to see you. And so what was the approach like for her? And can you contrast that from a traditional approach?
Yeah. So, well, I think she was really lucky to have been able to see you because you're going to go even deeper than what I think she would get routinely. So someone I think with chronic fatigue who goes to a general traditional medicine, either their PCP, primary care provider, or another, kind of traditional doctor would get a bit of a workup, right? You think fatigue, you think anemia, maybe thyroid diseases, maybe infection. You would do some tests. They all come back normal. Often. And then the provider would say, everything's normal. I think you should really work on your stress or, something like that. And I think that's where patients get frustrated. And so you were able to give her even a more deep and thorough workup in the autoimmune disease area. So now that she's sort of ruled out for those things, what I start to think about are the overall body systems that may not be working optimally for her. So the first thing that comes to mind is mitochondrial dysfunction. So mitochondria are the structures in each of our cells that make our ATP, which is what fuels our bodies. And if they're dysregulated, people don't feel good. They feel very tired. Also, gut dysfunction, really important. So I can't stress how important it is because the gut is the most common source of hidden inflammation in the body. And so even if people have no gut symptoms at all, you can often find inflammation in the gut, which leads to all sorts of extra intestinal, non-gut related symptoms, such as fatigue. Go ahead.
So go ahead. Go ahead now.
Yeah. And the third body system that I start to think of are hormonal imbalances. They will make you feel terrible and fatigued. And so when I'm thinking about hormones for a young person like this, I'm thinking about what is her cortisol doing? Is there cortisol dysregulation? Because you can have normal cortisol, so it's in the normal range, but still have it be functionally not working so well for the patient. I also want to consider sex hormones like estrogen, progesterone, testosterone, and thyroid. I would go very deep into thyroid. I think I want to just sort of say this. A lot of times in conventional medicine, you'll get a thyroid stimulating hormone, a TSH. I think everybody's pretty familiar with that. And that can be normal, even if the thyroid is not working optimally. So there's ways to kind of go deeper with thyroid testing that could signal, something being off and create the symptoms such as fatigue.
So I think where you and I overlap, just talking about this individual, this young mom that I referred. So you and I are both one and the same, and that we are looking at lifestyle in terms of sleep quality, number of hours of sleep, what's the type of exercise, what is your stress level, what type of stress, how's your diet? I mean, I think that we share that.
Yes.
But I love what you mentioned as far as just talking about mitochondria. And for her, like, how did you figure out, or how do you know that she may have a gut issue if there's no symptoms?
So I would do gut testing. I mean, that's the simple answer.
Okay.
And I really sort of recommend this for all of my patients, regardless of what they're coming in for, because we often find things there. And we often find things there because our American diet, unfortunately, is not the healthiest. And even if you're eating very healthy, so much of our food is depleted of nutrition. And so it's really important to see kind of what's going on in there, to be able to kind of fill behind where people are just, their guts are not doing well. So
is it like lab tests that you ordered for her, Elise?
Yes. So it's a comprehensive stool test, and it's not lots of people have done stool tests before for infection and things like that, but this is not a kind of test that like LabCorp or Quest will run. It is a specialized functional test done by a specialized lab. And it is not just testing for microbes, infection. It is also looking at the microbiome. So that's billions, trillions of organisms that live in our large intestine and keep us healthy if we keep it healthy. We can look at that. We're also looking at intestinal health markers, like how well is the person digesting? Is there inflammation in the gut? Are they reacting to gluten? That's a big one. It's not a celiac test. I just want to make that distinction. There are other tests that you do to look at celiac, but you do get a sense of really what's happening in there, and you can start to make adjustments once you see that.
I see. And so, so do the results of, like, let's say the comprehensive stool test, do they guide in what supplements you choose?
Absolutely. Yes. And they'll guide in how I'm advising around diet.
Okay. Do all people get this comprehensive stool test because of the importance of gut health as it relates to our health?
Yes. And because of the really large number of people that'll have a lot of leakiness that's causing all sorts of other problems in their body. So, yeah.
I think that's really enlightening. And I appreciate you sharing that, because I think that, physicians, but also patients, that it is mysterious, the labs that you order. And I think that I just had an aha moment, what you described in terms of, like, okay, like that makes sense to me, that if someone, I mean, this is, I see, and lots of doctors see people that they have symptoms, they're persistent, they're ongoing, but, there's not a diagnosable condition yet. And this is like, what a perfect analogy also, like the tip of the iceberg. And this is, I feel like, like I'm having this like amazing moment right now, just understanding a lot of what you do. So thank you for just going into that and exploring that with us. So transitioning. Okay. So how quickly do people start to feel better after they initiate, let's say that you got the comprehensive gut panel, stool test, and they start supplement? What's the timeline that you tell them?
Yeah, another great question. The very short answer is it depends. So I'm going to say what it depends on, and then kind of what I have seen. So it depends on how long has somebody been dysregulated and feeling terrible and having all these symptoms. The longer that it's been, sometimes the longer that it takes to heal, right? That would make sense. These problems with that people come with did not happen overnight, and they're generally not due to one thing. They are multifactorial. Things are compounding in the body. The body is very resilient and trying to do all the things to keep you healthy at all times. But and so it has a lot of backup mechanisms, but they fail over time. And so it gets harder to, put everything back in order when a lot of time has passed, but it is still possible. And so what I tend to see, depending on what's going on, is that even in a week, some people can feel better. They notice something different. It's not like they're 100%, but they notice something different. By 4 weeks, 6 weeks, they're like, yeah, okay, I'm sleeping better. This thing is easier in my life. Oh, I'm not, as fatigued at the end of the day. Or, if it's, they're having gut symptoms, like, oh, my poops are starting to look more normal. So I would say that we're looking at the kind of 6-8 weeks, and then things continue to get better from there. And I want to kind of distinguish that also from conventional medicine, because I really think that, well, in our lives in general, we're always looking for this quick fix, like take the antibiotic, you're going to be better. Take the pill, you're going to be better. And truly, the body takes time to heal. And so the timeline is generally longer with functional medicine because we're really getting at that root cause and giving the time to the body to reorganize itself back into the normal.
And so I think it's great that you're emphasizing the timeline, because I do feel that, especially if symptoms are really disruptive, that people do want to go back to, doing things day-to-day life the way that they want. And so I think I give the analogy, it's like running a marathon. Like, when you run a marathon, you're not thinking about mile 26 when you're at mile 2. You're thinking mile 2.
Right.
So I think that timeline is really important to emphasize. How do you feel like that's received when you're telling people of this is a process and it's going to take a while?
Yeah, I think often by the time people come to me, they're willing to hear that. Like they tried, they've done these other routes, that's not working. Like, I think that they're willing to do the hard work. I actually have a question in my intake form, like, how committed are you to being well? And like 9s and 10, it's 1 to 10. How committed are you? And I get 9s and 10s because people are really, frustrated and wanting to get there. So I think they do understand that.
And so the patient that I referred to you, like, did you start supplements for her, and how has that journey for her been going?
Yeah, so we're in the testing process, and we are going to be testing the things that I mentioned. So we're going to be looking at her energy systems, her hormones, her gut, and in the meantime, I recognized that she was pretty vitamin D deficient. Her vitamin D was way too low. We like to see vitamin D up around 60. So I got her started on vitamin D supplementation. And then the other thing was that she was not anemic per se, but her iron stores were very low.
I see.
And so I started her on a bit of iron as well. And so those two things alone could help potentially with the fatigue. But again, like I said, like these things are always layered. So, we're starting with just some basic nutrients, and then we're going to see what we get, and then we can start layering in other things.
And I think in this space where, the purpose here is really exploring chronic fatigue, because we both see that. And I do think it's important to emphasize how multifactorial fatigue is. And I really think people, they're so wired sometimes and naturally to think it's one cause, but Absolutely. It is. It's like, and then again, just this lovely lady that I referred to you, her sleep was non-restorative. So she improved the sleep. That's just one part of it. And sleep is just so vital, as we all know.
Yes.
Well-being. That it's layered. I like that. I think I completely agree with that, it is, more than one underlying cause. And then is it physically your body's tired? Are you physically sleepy? Like, how are you defining fatigue also, right?
Yes. Right.
So in terms of supplements, so that, there's so many, it can feel overwhelming. What advice can you give for either doctors, providers, patients that are interested in supplements?
Yes. Okay. So number one, I want to set expectations. Understanding supplements, it's a lot. It's a lot to try to understand. So the first thing for everyone is make sure that there's third-party verification in the supplement that you are purchasing. And so there are companies, so a company who makes supplements can hire a third party who tests their supplement to make sure to verify that what's in the what says on the label is actually in the bottle, right? And that because we hear lots of stories about you're buying, water pills or something. Or sugar pills, I should say. And so there are 3 different third-party verifications I can share. Consumer Lab is one, USP seal, or the NSF seal. Those are 3 different third-party verification companies. So you can see those seals on the bottle. That's really important. I think when you are a patient and you're, a person out there, not a provider that's just looking to do something for themselves, I think there's a few things. A multivitamin is always a great idea. It's small amounts of all the required vitamins and minerals. And I think, you can't really go wrong with that. And then the 2 most depleted other nutrients are vitamin D and magnesium. So if you were to supplement with some vitamin D and some magnesium, you're likely doing something good for your body. And then in terms of providers out there wanting to learn more about supplements, I think that there's some basic things that somebody can do and some more advanced things. So there's a doctor out there, Dr. Michael Greger. He has a free podcast called Nutrition Facts. He's been around a long time. He definitely is on the kind of vegan side of things, but he goes very deep into the science. So I think that's a great resource. There's also a very inexpensive CME from the Gaples Institute, which is this nonprofit organization. They are dedicated to promoting the role of nutrition and lifestyle in medicine. And so they have a 4-hour CME for $50. So really, and it's a really affordable and it's a lot of really good information. And then there's more advanced options. A4M, which is the American Academy of Anti-Aging Medicine, they have this whole longevity fellowship, but they have a specific certification workshop called the Supplement Certification Workshop. It's 25 hours. So that's, a much more, a larger commitment. But that will give you a lot of information about supplements. And then there's also other A4M courses. And then, of course, IFM, the Institute for Functional Medicine, they have courses also that someone could check out.
I see. So, no, that's very helpful. And I would encourage people to check that out too, because I know I get a lot of questions about supplements as well. Now, do you have any rules for yourself as far as maybe and for listeners as well, not starting more than one supplement at the same time?
I do. I actually have it on my treatment plan. Please don't start more than one supplement at a time.
Okay.
So I do because, people are wired differently. That's the whole, idea of this actually is that we're doing this in a very personalized way. And so how one person reacts to something will be different sometimes than someone else. And so it's really important to do one at a time. So you start something and you take it a couple of days, and as long as it's going okay, then you can add the next thing. And the reason to do that is if you have a side effect, then we know what did it. Versus if you start 5 things at once and then you say, oh, I'm feeling this way, I don't know which one it is. And now you got to stop all of them. So yeah.
So how long do you wait between do you recommend waiting from one supplement to adding another one?
It's usually 3 days, 2 to 3 days. Yeah.
I see. And when you start, do you start some of the supplements, it's 2 capsules with every meal. Do you follow that, or do you generally recommend starting once a day and then increasing it to twice and 3 times? Is there a rule that you follow?
Yeah. So so if you are a patient out there, a person who's not a provider, who's trying to kind of get into some supplements, I would follow what's on the bottle, because the bottle is going to be sort of the potentially lowest effective dose. The company will always put a lower dose on the bottle. The provider will titrate for the patient. And I don't think that patients should do that alone. So the provider will say, okay, we're going to start with this dose, but we may increase over time up to a higher dose because that's something I think you need based on your, specific labs.
Do your patients feel sometimes it's a lot of capsules, a lot of pills to take?
Yes, they do. Yes, they do.
Mm-hmm.
It is a lot.
Mm-hmm.
And I think it makes a difference.
Mm-hmm.
And so I feel like everybody has to decide what's okay for them, what works for them.
Yeah.
And we go from there. There's all sorts of beautiful pill carriers out there. So you can have them organized and travel with them and things like that. But I do understand that it can be a lot for people. And so we just, when I'm working with someone, I have to figure out how to kind of design the protocol for them where they're comfortable.
And I think ultimately, like once people are feeling better and they're feeling healthier,
yes,
like it's fine. They feel okay with that. It's just, I do feel like at least with conventional medication, I'm always having that conversation and so I'm just curious, if you come across that as well.
Absolutely. All the time. It's a common conversation. So what I've started to do now is I try to start early the kind of basic nutrients like vitamins and minerals and antioxidants that, sort of everybody can benefit from. And then what, they're taking those while they're getting their lab tests drawn. So it's a few weeks. So they're kind of comfortable with it. And then we get the labs back and then we can add more and they're already comfortable with that amount. So I try to layer over time.
That sounds great. So, how does someone work with you, Dr. Pomerance?
Yeah, well, they could just go to my website, our website, which is eleenahealth.com. And there's a button, says contact us or get started. And you just send an email. And I'm Elise at eleenahealth.com. And I always do a discovery call, a free discovery call with everyone and figure out if we're a good fit, what's going on with someone and what I can offer. And I am a membership-based practice where people kind of join Eleena Health for a certain period of time. And during that period of time, it's direct access to me, unlimited appointments. And I'm touching base with patients all the time. And it's one of the things I truly love about my practice is that I get to spend as much time with patients as they need, so that they can feel heard and that I really understand what understand their story and their journey. And I can, select the right thing to do, and I can limit the membership so that I can really do that with my patients.
I think that's amazing, and I think it's I see just in a similar structure of my practice, and having worked in traditional medicine for a very long time as well, just the difference in the quality of health and the improvement of one's health just by having more time. Like the 15-minute appointments are not adequate to be able to even barely touch on all of this. And what you're offering, I think, truly is amazing. And thank you for being really a wealth of knowledge here today, helping us learn more about functional medicine. I'm sincerely grateful I met you. I love that, I feel like when my patients hear about you, their face just kind of lights up and they're very excited. So I'm really, truly grateful to have you. And for listeners, I really hope today's conversation leaves you feeling supported, empowered, and with peace of mind as you navigate your own health decisions. Thank you for joining us on Everyday Rheum and have a wonderful day.
Thank you for listening to another episode of the Dr. Raj podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.